I'm at the third international conference on dengue and dengue hemorrhagic fever here in Bangkok, where I'm joined in conversation by Dr. Alex Perkins from the University of California, Davis. Alex, welcome.
Thank you. It's nice to be here.
Can you talk about how dengue is becoming a global challenge in terms of the way people shift around?
Yes, so dengue has been on the rise for the past few years across the globe. It's expanding into new areas, and even in areas where it's been for a while, new serotypes are invading and causing many more people to get sick. Estimates published this year showed that up to 3 or 4 billion people across the globe may be susceptible to dengue, so it is a growing problem.
And what does this research mean in terms of discovering patterns of how the disease migrates?
So it's important to understand once the disease gets to a new area, how it spreads throughout a population. And one of the big factors that determines how it spreads is how people move around. Since the mosquito that vectors the virus between humans doesn't really move very much, it's really human mobility that drives how the pathogen spreads throughout a city.
So Alex, what does the research tell you or show us about dengue and the migration patterns of the disease?
Right, so at a very fine scale where we care about people moving throughout a city and spreading it from one neighborhood to another, there are two major ways that mobility factors into that. One is how people who are susceptible to the virus, the places that they go determines where they might pick up the virus and what their risk of exposure is. On the other hand, when a person's sick, the extent to which they move around affects how many other people might be impacted by the disease. And the research that we've done shows that there are differences in how healthy versus sick people move about. So what we found specifically was that people who have recently been infected tended to go to fewer places, and they also tended to spend more time at home. And I think we can all relate to this. We've all had flu or some other illness that's kept us in bed all day. And the same thing really happens for dengue, but this is something that hasn't really been accounted for very often in mathematical models that are used to predict how it spreads through a population and to predict the impact of various control measures.
Is it getting worse in terms of spreading through populations? What are sort of the key affected areas in the world at the moment where dengue is really having an impact?
Well, so it's always been a big problem here in Southeast Asia, but it's certainly on the rise in Latin America. They have a less intense history of dengue, so there's a lot of people who are susceptible to new serotypes from Southeast Asia and elsewhere. So.
What are the biggest challenges that you're facing at the moment?
So some of the big challenges are how exactly to control the disease. And part of that is figuring out from a basic scientific perspective how the virus spreads through populations. So the better that we can quantify that, the better that we can figure out how much spraying we need to do of mosquitoes. If we did have a vaccine, how much would we have to deploy it? Where should we target these control efforts and on whom? So those are some big challenges in terms of figuring out how to actually apply controls in the real world.
Okay, and what are the benefits, say, of having a big international get-together like this in terms of how we deal with dengue in the future?
Well, it's really essential in terms of this really is a very global disease, and different people tend to focus on different parts of the world. Yeah, it's the same disease affecting people in the same way in many cases. So it's important to hear about what's going on across the world. And here at this conference, there's people taking a number of different perspectives from different scientific backgrounds. I myself do more of mathematical modeling and epidemiology, whereas others do much more basic laboratory science. And we really need to have a multiplicity of approaches in order to understand the disease and actually have some impact on it.
These conferences seem to be becoming more regular. Does that reflect the fact that more is known about dengue, or is the problem becoming worse?
It's probably both. We have learned things, but at the same time, it's becoming a bigger issue, and I think it's drawing more interest from scientists across the world.
Dr. Alex Perkins, thank you very much for joining us.
Thank you.